Hi, my name is Addison Novak, and today I'll be telling you about cardiac pacemakers. Cardiac pacemakers are a small medical device implanted under the skin to help control abnormal heart rhythms. They do this by delivering electrical pulses to simulate the heart when it beats too slowly or irregularly. They put these in different chambers of the heart, like the right atrium, the right ventricle, the left ventricle, or the epicardial, which is on the surface of the heart. These were originally external pacemakers, so they were outside of the body, and they were invented in 1950. And then 8 years later, like we know them today, they became internal pacemakers, so they're on the inside of our bodies. Our modern devices are smaller than a matchbox. They are battery powered and they last between 8 to 15 years. Who are these pacemakers for? They are for people who have bradycardia, heart blocks, sick sinus syndrome, and irregular heartbeats. I found this excerpt from a passage. They are used primarily to treat bradycardia due to sinus node dysfunction or atrioventricular block. Among other cardiac conditions, pacemakers can be temporary or permanent depending on the patient's needs, and advancements in technology since the 1950s have greatly improved their functionality. Modern pacemakers and implantable cardioverter defibrillators form a category of cardiac implantable electronic devices. While the implantation procedure is generally safe, risks such as infection, lead dislodgement, and battery depletion must be carefully managed. And I got this from the National Institute of Health. Okay, so the average total cost for the implant, the surgery, and the follow-up is 20,000 through 40,000 US dollars, and the insurance is usually covered by Medicare, Medicaid, and or a private insurance for eligible diagnosis. And usually after insurance, which it varies on the plan, you would be paying 2,000 to 6,000 out of pocket. And for the regulations, it must pass FDA approval, which include pre-market approval for safety effectiveness and rigorous clinical trials, which can last from 5 to 7 years, and a regulatory body, which is FDA, EMA, and equivalent authorities globally. Their lead producers are Medtronic, Boston Scientific, and Abbott, which used to be called St. Jude Medical. And the demand of 1 million implants annually is due to aging populations and increase of heart disease. The patients get immediate symptom relief and improved quality of life and longevity, but there are a lot of risks with it, which could be like infections, and providers get easy to implant and easy risk of infection and device malfunction. In summary, this shows the role of tech that manages chronic diseases. It reduces emergency exit visits, life extended care. They are essential tools for modern cardiology and low surgical risk, but outcomes can vary.